welcome to our gold participants. I'm Fiona Langsharp, IBCLC and Public Relations Manager and MC for Gold Midwifery Online Conference 2016. Well, welcome to my sit-down interview with Karen Strange. Karen, it's lovely to have you back again at Gold Midwifery.
It's nice to be here. I love gold.
Well, we're excited, and I am so intrigued to hear what you have to say about this presentation. And just for our listening audience, Karen is going to be speaking about when, why, and how to give those first few breaths at birth. Such an intricate subject, Karen, and I know that you're going to be sharing lots about it. But firstly, let's go back to the beginning. Why don't you go ahead and introduce yourself briefly and tell us what you've been up to recently?
Okay. Well, so I'm Karen Strange, and I'm a certified professional midwife. I trained here in the United States. I practiced as a midwife for many years and became an instructor for neonatal resuscitation. Oh my goodness, way back in 1991, when neonatal resuscitation program first came out. And I didn't start teaching till I moved to Dallas, Texas, and I started teaching just locally because there were a lot of midwives. They were very organized, and it was very legal. And when I started teaching, I really noticed how much fear there was around resuscitation. And that really sort of began my passion to figure out how to teach this particular subject that brings up so much in all of us. Resuscitation, right? You know, has life and death impact. How to teach it in a way so that people actually had the skills and knew what to do if a baby was in distress.
Absolutely.
Oh, and
so yeah, go ahead.
I'm sorry. Well, you also asked me what I've been doing lately. So other than I travel around the United States teaching the neonatal resuscitation program, but a whole lot more. And I've recently been going to Brazil, teaching a lot in Brazil. There's a very large humanized birth movement there with some amazing midwives. And so I've been teaching resuscitation and lecturing a lot on the baby's experience of birth. So I do a lot of traveling. That's what I'm doing. I'm trying to get more like gold so that I can reach more people. And I'm so thrilled to be here to be able to reach more than I can travel to. So thank you, all of you.
Wonderful. Well, it's great to hear that you are able to continue to teach and around the world, because I know that you're impacting many lives. So in your journey here and teaching about resuscitation, tell me about the times, or tell me a little bit about, you know, how this really became important to you, this specific topic. Was there an experience? Did you feel like there was a lack of knowledge? The understanding was missing? Like, you dove into this, Karen. So somehow, you know, along the way, this became a passion of yours. I want to know why it's so important to you.
Well, I think as I said, when I started teaching, not just people that I knew, but started really teaching my community and reaching out to midwives throughout the United States, I just noticed how much fear and how incapacitated people were even just practicing in a classroom. And that really became the impetus and the drive to figure out a way to not only teach it but explain it so that people had a felt sense of what to do. That it wasn't like just numbers, that they weren't memorizing numbers. It's all about the numbers. It's really about what do babies need. I mean, I teach numbers, and when I go through the class, I'll go through numbers, but it's not about the numbers. It's really about the transition that babies make when they go from in utero, breathing through the placenta or with the placenta, to what happens to them so they can be air breathers like you and I. And just the drive and the passion to figure out a way to really explain this beyond what is sort of out there, the material that we're given as educators in neonatal resuscitation education, in our midwifery books. But a real visual, as I said, felt sense of what
Mm.
needs to happen.
As I was listening to you say that about the felt sense and really understanding beyond what our books teach us and all those types of things, I'm starting to imagine that you're trying to put yourself in the baby's shoes, so to speak, and give a voice, give a voice to what is happening as they transition, from water breathers to air breathers. So yeah, it's very intriguing. I'm getting the imagery in my head, but I know that you're going to help us understand even further. So as I'm looking forward to listening to the whole presentation. I don't want you to give away too much today because I really want people to come and hear more and really experience and join together in this opportunity. But can you tell me what are you hoping we will learn from this presentation, Karen?
So, I guess really, I mean, I'm going to go through a lot of explanation of what needs to happen, but it's really about two slides that say it all. That babies in utero are not breathing with their lungs, but rather through the placenta, and when they come out, they have to transition to breathing through their lungs. And so my goal is that people, I
Hmm.
feel kind of repetitious here, but people have a felt sense, a knowing of exactly what's happening for the baby, that there isn't a question because it's a pretty simple thing that occurs when they come out. And I do talk about the cord. That's one of my passions, talking about the cord and optimal cord clamping and all of that. But this is aside from the cord. This is, even with a good cord, babies need to become air breathers once they come out. They may have a little extra time, maybe,
Hmm.
with a good pulsating cord, but they really need to be transitioning and moving towards air breathing. And my hope is that people that take the class will have an aha moment around, oh, we could have done that. That would have saved all those hours of waiting and putting the baby in the in the humid room, or working with the baby that was having a little difficulty nursing because it still was trying to establish
Mm.
homeostasis. It was trying to establish normal breathing. So that's really my hope, that people will know what they can do, what they can try that is not going to hurt the baby. That's always my goal, Fiona, is to give the baby's experience, whether it's the physical experience of going through the birth canal and what happens when they come out, but also the experience of what happens to them when they're having difficulty breathing. So, so that's my goal. Yeah, is to really get that point across.
That's awesome.
So
And
there's no questions.
I love that. I loved you mentioning the aha moments because this is where, our continuing education becomes so valuable to us. And I know that there'll be many people at your presentation who will have those as we've had them in the past. But I think as we come together as birth workers, we collectively learn so well with you, Karen. So I really appreciate you just spending the time. And I want to talk more, but I want to intrigue people. I want people to come and listen. It's going to be fantastic. And it's going to be at the Gold Midwifery online conference with Karen Strange. Karen, thank you so much for sitting down with me here today and just answering those few questions. I'm looking forward to chatting with you some more again.
Yep, I'll see you in like a week and a half, I think.
That's awesome. Well, thanks everyone for listening. That's all for now, and have a great rest of your day. Bye bye for now.